My name's Sarah Holland and I'm the founder of Fertile Mindset, where I support people who are going through the emotional pain of infertility, and I help them to find a positive way forward on their journey. And I'm a certified EFT practitioner, and this is the technique that I use with the people I work with. I've worked in the area of infertility for around 10 years. First of all, that was through reflexology as a complementary therapist. And then soon after, I learned the technique of EFT and use this with all of my clients. Also, I have been through a personal struggle with infertility, which happily ended in the birth of my baby boy, who is now 4 years old. But that means that I do have both a personal and professional experience in the issues of infertility and all the emotions surrounding it. So the kind of people that I work with are trying for a baby. It's taken longer than they expected it to. And they've got to a point where they're feeling overwhelmed emotionally. Perhaps they don't know where to go next, what options to look at, what treatment to go for. And they're really at a standstill emotionally, or they might even be at the point of giving up. So when I speak to them, I help them clear the emotions that are going on for them at the time, get rid of the fear, the anxiety, the worry, so that they can get back to their own kind of natural inner strength and resilience that we all have beneath the surface, and help them find a positive way forward towards having their baby. So I might speak to people who are going through infertility treatment such as IVF, or perhaps they're at the point of trying to decide whether they should continue trying to conceive or look at another route like adoption. It's really very wide, the span of people that I speak to, including women who are pregnant as well, because they maybe have got pregnant after an infertility struggle, and the stress doesn't stop there. In fact, it can be even more stressful in that first crucial 12 weeks. I believe in empowering the people I work with to make really good decisions themselves and take some control back of their fertility journey. That's not easy when they're overwhelmed emotionally, because they may have all different options in front of them, different tests, clinics to visit, treatments to pursue. But when they're stressed and overwhelmed emotionally, it's really hard to make good, clear decisions. So I help support them as they work through those emotions, but then also point them in the right direction to find out more information about what they can do to boost their own fertility and take some control back. EFT stands for Emotional Freedom Techniques, and it's also sometimes just called tapping. It's a therapy that is quite modern, but is based on the ancient Chinese meridian system that is used in acupuncture. However, with EFT, we don't use needles. We use a gentle tapping technique on stress release points on our face, upper body, and hands. And it's essentially a self-help technique that anybody can use. It's very easy to learn and simple to use, and the results are very effective. And it's been used for some time now on a wide range of emotional issues: anxiety, phobias, weight loss, all kinds of things. And I've really taken this technique of EFT and specialised in using it for fertility issues and all the issues surrounding it, all the emotions. Plus, I believe it does help give a woman and a man a better chance of conceiving their baby if they reduce the stress involved in that journey. I've always enjoyed being a therapist, and when I was a reflexologist, I automatically seemed to attract pregnant women and women who were trying to get pregnant. And then when I started on my own fertility journey, which I didn't know was going to take so long, I got a real personal interest in infertility as well. Combining the technique of EFT, I really got in depth into the emotions and all the issues surrounding it. And it absolutely fascinates me that there is a way that we can make the fertility journey less stressful and more enjoyable, and getting back to that sense of hope and joy and excitement that was at the very start of the fertility journey. So I really enjoy working with people day to day and helping them turn around their emotions.